So let's talk a little bit about drug prices and why tackling drug prices is so difficult. So what we're seeing on this slide is about the flow of medicines, money, and contracts, business agreements between different entities in the US market. So in other countries, depending on the country, this graph would be totally inapplicable, but this is specifically for what's happening in the United States. So what you'll see here sort of in the middle as the heart of the flow of medications and money is that we have consumers, right? So consumers need the medications. The doctors or nurse practitioners prescribe certain medications to treat specific conditions, and people want to get the medication. So they go to a pharmacy. They either, sometimes it's an e-prescribing where the doctor or nurse practitioner has already sent over the prescription, or the patient presents a paper script and then the pharmacist or pharmacy technician is able to fill that prescription. So people go to the pharmacy, but where does the pharmacy get the medications from? Well, the pharmacy gets the medications from a distributor. The distributor gets the medications from the actual manufacturer. So that's the actual flow of physical medication in the system. There's also a flow of money and of business arrangements or contracting. So patients or consumers have the legally binding insurance contract with an insurance company, which on this graph we call a payer. So the insurance company, though, is maybe not an expert in everything about medicines, right? So there are thousands of medications that are sold in the United States, many different medications that are used for many different medical conditions. And so in health insurers, instead of being experts in every single medication that people might need and like trying to figure it out on their own, have come to the decision, like what they'll do is they'll contract with this other legal entity called a pharmacy benefits manager. But sometimes a pharmacy benefits manager is actually owned by an insurer. To make an example, United Healthcare owns Optum. So they create this separate legal entity though. And so that legal entity just specializes in trying to figure out which medications to cover, developing a formulary, and then negotiating with the drug manufacturer on the price of the medications. So a pharmacy benefits manager has a business agreement with health insurer, and they also enter into contracts or business agreements with the drug manufacturers. And pharmacy benefits managers are held to different standards than health insurance companies. So pharmacy benefits managers have a lot of power within the system to determine which medications health insurance subscribers or consumers actually have the ability to buy. And then also they have a lot of power, especially the larger they are, the more leverage they have with the drug manufacturer to try and get the drug manufacturer to sell them the medication for less. But the pharmacy benefits manager is not the actual distributor, it's a different entity. But the benefits manager is in charge of developing the formulary and negotiating with the drug manufacturer.